Hi guys, welcome again to the Dr. Tebz Diaries. So this week we're talking about squints. And squints is such a common condition that, many people tend to ask me, on Facebook or Instagram, but mainly Facebook, about where can I go get my squint fixed, or where can I go get help for my child's squint, and so forth. So I'm going to be answering various things now in the Dr. Tebz Diaries now about this. So first and foremost, I wanted to explain that as a parent or as yourself, you want to explain to the doctor what is this funny eye movement that your child is, doing or manifesting in the eyes. So first and foremost, you need to understand the different directions where the eye is moving, okay? So there's always the one eye which is looking straight. Most of the time, this is how normal squints are. So there's always one eye looking straight. Then the other eye is the one that is deviating or is abnormal. So there's different directions. So there's the exotropia, where the eye is moving towards the nose. So basically it does that. And then there's this eye is looking straight, this eye is looking outward, and that's what you call an exotropia. So this one's looking straight, the other one's looking away from the nose. And then there is a hypertropia, where the eye is looking up, and then there's the hypotropia, where the eye is looking down. So you've got esotropia, exotropia, hypertropia, or hypotropia. Or you can basically just explain to the doctor that the eye is moving away from the nose, moving towards the nose, moving up or down, so that they can understand better. And then the second thing that you need to note is if one eye is looking straight and the other eye is always the one that's looking in, okay? This is important because if they're changing over, then it's most likely that both eyes are developing. But if one eye is always looking in, that eye, becomes lazy. So now I have to actually explain to you the development of vision in a child so that you understand why it's important to take your child in for assessment, especially when they have a squint or any other eye problem at a young age. So kids, when children are born, the connections between the eye and the brain are developing. So let me explain it this way. Your eyeball is the camera. Your brain is the TV screen, okay? So if this camera and the TV screen are joined by the cable, this cable is being developed in your childhood. Okay, so basically, you see with your brain. You don't see with your eyes. Your eyes receive the light impulses, and they travel down the cable, travel down the nerve connections to the back of your brain, where you actually see. So this whole entire process and development is happening between the ages of 0 years to 7 years, okay? That's what we call the critical age. I'm just putting those terms out there. That's what we call that important time where these connections are forming. So you need to have clear vision. You need to have single vision, okay, in both eyes. So both the eyes need to be seeing the same thing. So in squints, if the one eye is always looking in, then this eye is looking over there, this eye is looking straight. And the brain is just like, oh my gosh, I can't handle this. And what it does is it shuts down this eye. It starts ignoring this eye that is looking away in the abnormal direction. And so this eye that's looking straight is the one that's always developing. This one that's looking away is not developing. So then it becomes a lazy eye, meaning the vision in that eye is not developing well. And this condition, we call it amblyopia, okay? But this is why you need to get the child assessed, because if this eye has been lazy until the age of 7, we can treat it and we can try to improve as much of the vision as we can. But this is why it is important, and unfortunately, we wait and then, the child is now 7 and the squint has been like this in one eye all the time, and that is a problem. So if they're both changing over, then each eye is getting a chance to develop. But if one is always looking this way, then it's a problem. Okay. And then the other thing that Professor Tinley said is that if a patient has got a white pupil, then that is a problem. When you take pictures, when you take photos, with your camera, and there's a flash, you get that red spot in the middle of your eyes. That's what he's talking about. You get that red spot in the middle of your eyes. That's a pupil reflex, okay? If the pupil reflex is not red, but it's white, then that is a very bad sign. Or if you looking at your child inside the eye, you can see, no man, that black dot in the middle of the eye is now going white. That is a very, very bad sign, because the child could either have a cataract, or it's even worse than that. The child could have cancer in the eye. Cancer in the eye can present as a squint. Cancer in the eye can present with that white dot. So if you see your child having that white spot, you must not ignore that. You must take your child immediately to the hospital, and we need to see the child as an urgent matter, almost as an emergency. Okay, so yeah, so that's what I actually wanted to talk about in terms of that. And then the last thing I wanted to mention is about the surgery. So the surgery is fairly simple, as Prof. Tinley had actually explained, that we are just dealing with the muscles. So basically the reason why you don't see the muscles when I'm looking at you and you look at my eyes, you don't see my muscles around my eyes, is because, you know, there's a jacket that's folding over the eye. There's a skin, as he just described. And so the complications, basically, you know, just to elaborate or to expand on that, is that the complications is that skin that's around the eye that we cut open to get to the muscles can actually become red, because there's bleeding inside of it, swollen, you know, but we give drops, and over a few days it becomes better and the child feels better and the swelling goes down. And then over time, those stitches that we leave in there melt away on their own, and we don't have to take the child back to remove the stitches. The stitches basically melt away, are absorbed, and then they're gone. Okay. And then the other complication, as you said, we can either correct it, overcorrect it. So you're taking a squint that was basically pointing in, and now it goes outward. That's one of the complications. Or the squint that was deep in is now just a little less in, but it's a bit more in. I mean, it's less in, basically. So it goes from there to there. So you undercorrect it. It's not completely straight, you know. And then the other thing is that a child may need to go for 2 surgeries, because of the fact that the size of the squint is so big, you know. There's some squints that are so big that the angle, because we measure the size of the angle, and then according to that, then we decide how much of the muscle we're moving back or we're shortening and so forth, you know, how to operate. So sometimes the child may need to go for 2 operations instead of 1. And obviously, as he said, some kids don't even need any operations. We just give them glasses, and that fixes the problem. So yeah, so squints are a very interesting condition. Oh yeah, before I finish off, there's a condition that I want you all to know about, that there's a squint that moves outward, and we call it an intermittent exotropia. What that basically means is that the child is often straight. You know, you look at the child, both eyes are often straight. But when the child is tired or not paying attention or hungry, then the eye starts to wander out like that. And as it wanders out like that, then when you say, hey, look straight, then all of a sudden they do this. And, you know, it's so funny. Some parents will come and say, doctor, there's something here. This child is looking straight now, but when he's at home, this eye wanders. It wanders out, you know. And so in those instances, it just depends how often the child is wandering out and how it's affecting his vision, the squint. Then only when it starts affecting his vision severely enough, then we will treat that squint in terms of an operation. But if it is controlled most of the time, the child is straight most of the time, and only sometimes the eye wanders out, we will watch, okay? So I know that some parents will say, but doctor, why don't you fix the squint? You know, I want it fixed. You need to understand that not all squints are treated the same. Each and every squint is different. So that's why Prof. Tinley said we need to assess the child, and then we make the decision to how we're going to move forward with the child. So it is important that you understand as a parent and ask questions. Doctor, should we fix it? Why are you not fixing it? You know, all of this. It's important for you to understand what is happening so that you leave those consultation rooms, you know, satisfied and feeling like, okay, I have been helped. Otherwise, I find that most parents who are not getting an immediate treatment of operation, get the eye straight, let's move on, they get very tired, they get very irritable, they get very frustrated with the doctor that we're not doing what it is they expect. So you have to balance your expectation and what is really happening, you know. And I know that parents want to have kids with no eye problems and everything is fine and we all move on, but sometimes you have to go through this journey. And that's what I call it when I speak to parents about squints, that we are going to be traveling down a road together. We are on a journey, but eventually that journey will come to an end. But I needed to be patient on this journey. So it's not a one-stop shop. Come, fix the squint, gone, finished. No, it is a journey. So yeah, so that is the Dr. Tebz, you know, diaries for today. And I hope that you found this very informative and interesting, and it's an important topic. And so if you would like to continue, you know, watching these videos, please do like and follow the Dr. Tebz show pages on Instagram and on Facebook. You know, I post these every Thursday. So until next time, I will see you on Sunday at 4 p.m. And remember, take care of yourself, take care of each other, and remember, your health is in your hands. God bless.